Welcome to Prescription Health, a Tabula Rasa healthcare podcast. Prescription Health addresses the evolution of healthcare by focusing on news, developments, and predicted growth in value-based care models, including PACE. Join us every month for insightful conversations with subject matter experts by subscribing or visiting us at tabularasahealthcare.com/podcasts.
Hello and namaste, everyone. I am Dr. Ankur Patel, Chief Medical Officer at Tabula Rasa Healthcare and author of the book, Age is Just a Number. Welcome to the episode of Prescription Health, our newly expanded podcast, formerly known as Keep Up with PACE. I will be serving as your moderator for today's episode. We will be discussing growth and enrollment in PACE. I'm excited to introduce my panel. We have Amy Katz, Vice President of Strategic Growth at PACE Southeast Michigan, Mindy Wiles, Regional Vice President of Operation, Northern California, and Johanna Dickman, Senior PACE Consultant with Carevention Healthcare. Together with my guest and myself, we have 49 years of experience in PACE. Panelists, namaste and welcome to Prescription Health.
Thank you.
Hello.
Thank you.
Hello, I am excited to have you all and thank you for joining. So let me start with if you can briefly introduce your PACE organization and what senses they are at this point, as we'll be talking about growth and enrollment. So Amy, please kick off and tell us about your PACE organization.
Sure, I'd love to. Thank you. Thanks for having me. So PACE Southeast Michigan has 8 centers. We just got approved for our 8th center this week, actually. We should have participants transitioning there in the next few weeks. Our current census is a little over 1,600. We have about 1,620 participants that will be, attending the 8 centers. And we also have one corporate office that we house the corporate staff in kind of the local community. We service the Southeast Michigan region. We're one of 14 programs in Michigan currently.
Congratulations on your new program.
Thank you.
And when did your PACE organization started? When was the first center?
Yeah, so our first center was in 1994. Actually, we were one of the original pilot programs that started, and it was a very small program when it first started. Just a small little PACE program in conjunction with our local hospital system. And we have expanded greatly, mostly in the last about 9 years. When I joined PACE, we only had about 200 participants about 10 years ago. And now we're at about a little over 1,600.
Isn't that so?
Yeah.
That is amazing.
Yeah.
Mindy, please tell me about your PACE organization.
Absolutely. Yeah, I would love to. So I am the Regional Vice President for Northern California for WelbeHealth. We currently have 4 PACE programs up and running. We have an alternative care site attached to one of them. And then we are opening up 2 more programs on July 1st in both North Hollywood and Rosemead. Currently serving a little over 2,200 participants. WelbeHealth opened up that first program in January of 2019. So in Stockton, yeah. So we've had quite an abundance of growth the past few years.
That's amazing.
And currently in California, yeah. Currently just we just currently have programs in California.
Any plan to expand out of California?
I believe there's some talk about that eventually. Thinking of other areas where the need is greatest, I should say. We would like to go serve.
More PACE programs are always better. And Johanna, you have a very interesting background. So you have seen 2 sides of the coin. You were in PACE before, and now you are a PACE consultant. So tell me about your current role as a consultant and which one you like more.
Oh my goodness, that's such a good question. So I've been a consultant for about a year. So 18 of my 19 years, I've been in PACE operations, and just served in many, many different roles. I love PACE. I love everything about it. So I lean towards the operations. So consulting about operations allows me to stay close to it, and try to stay current on the things that PACE organizations are struggling with.
That
Yeah, so as a consultant, I'm a part of a 3-man team, and we're small but mighty.
welcome. That's exciting. So which one do you enjoy more? The consulting part or the previous?
Being in PACE operations is really, really tough. So right now, I really enjoy being a consultant.
Okay.
A little bit more variety too.
That is awesome. So I always start, now, hopefully COVID is history, so I'm not going back, but COVID was an opportunity that nobody wanted. So I would love to hear from you, Amy, to start with, like, what are the things you are doing with growth and enrollment post-COVID that you didn't do before?
Yeah, so we do a few things now, and I'll just name a few. So one of the first things we did was we started an employee referral program and a participant referral program to try to enhance the growth of participants. And the employees receive a gift card if they refer someone who enrolls. And for the participants, we started a mug club. And we have these really sweet PACE mugs, and it says Mug Club. And if they refer someone, whether the person enrolls or not, they get a mug. And so they strive to get these mugs. And it's really been really helpful, actually, for our growth. They live in a lot of senior buildings that they have friends and they tell them about that, or family or whatnot. And so we've seen that be a really nice addition to our strategies. And then we do also, we did this before, but we're doing it all on a lot larger scale, is that we are using our own internal experts, whether they be from rehab or behavioral health or our dietitians, to do community presentations at senior living communities. We did do a lot of activities in the past, and we would sponsor a pizza party or something like that, or an art program or something at the senior center, and be able to speak about PACE. But we're definitely doing a lot more education in the community, which people really want. We saw there'd be a elevated desire to learn more about health conditions. And so we've been doing that. And that's really allowed us great access into the buildings. And, it doesn't cost them any money to have it in their buildings. And so those are two of recent strategies post-COVID that we've been working on. And it's shown to be beneficial.
Yeah. So Mindy, with you, because it will be very interesting. You mentioned that WelbeHealth opened their doors in 2019, and then COVID happened in 2020. So did you have to pause your enrollment? What went through? Because for a new program, growth means a lot. So how did you handle that? What happened, and how did you handle the situation there?
That's a great question, because one of the things that I always say to folks is our growth is completely during COVID. Again, one program that was open in 2019, two programs that were open in 2019, and then the other two 2020. I think, honestly, COVID made it not easier by any means, but people didn't want to go to nursing homes. People didn't want to be, because that was where, we all know that's where people died. They didn't have really good outcomes. And so we had an opportunity to be able to almost promote, like, we can keep you safe. We can keep you in your homes. We can give you this wraparound care. And, you're not going to have to go into a nursing home. So kind of nursing home level care without actually being in a nursing home. And I think we really, there's a competing PACE program in Fresno, literally 4 blocks away.
Oh, wow.
And so a lot of people in Fresno are aware of PACE and know about PACE. And so it was kind of a not easy, but it was, again, I think there was a little bit of already us having having people who had knowledge of that be able to kind of pick that's where they wanted to get their care at. And I think, again, like, the whole COVID thing has showed us, like, PACE at home or PACE, like what we do in the community with people and keeping them in their homes, making sure that, we give them the tools that they need. Everyone got a GrandPad from us, an iPad from us during COVID, when they still are getting them. So we can have those check-ins, we can do those assessments, or those not assessments anymore, obviously, because of the telehealth waiver. But we can do those check-ins, and we can do activities. I mean, we really expanded our options, I think, for being able to take care of people, which if you're looking for lemonades or if you're looking for lemonade out of those lemons, that was definitely one of the things that, that we learned during COVID.
Wow. And you mentioned that you have other PACE organization 4 blocks away. So I think nationally our audience may not know that in a lot of state, actually, we have, like, for example, in New Jersey, it's pretty much the state assigns a certain zip code or a county. And there is just one PACE organization there with the goal of let's expand PACE first everywhere in the state, then we will talk about it. So it sounds like, Mindy, in your case, you can go into each other's zip code.
We can do that in California. I think one of the things that I learned since moving here 2 years ago for my job at Welbe is California uses the verbiage a lot around, like, there's just so many people, or it's so big that we can do different things. So yeah, our zip codes can overlap with other POs.
Yeah.
It just tells you, I mean, there's such a need.
Huh.
DHCS, the state wouldn't allow that if there wasn't that many eligibles in the community. So
that is also, is that the same in Michigan as well, Amy?
No, it's not. Actually, we do very minimally overlap. It's really kind of this unwritten rule that we are assigned a zip code and it's just one PACE program. There's a couple, we have so many PACE programs in Michigan that we do butt up against each other. So which is great for coverage, for eligibility purposes and people living in the zip code area. And there's a couple zip codes, that people can choose which PACE program to go to in literally, I think, 3 total zip codes in the whole state. But otherwise, it's an exclusive zip code assignment. So, yeah.
Wow, that even most, Johanna, like, I'm thinking, and I bet you are thinking and putting your consulting hat on, like, sometimes I feel like, oh my God, I just don't want anybody else to come into those zip codes and it's mine and I will grow. But then if there's no competition, I might take it a little easier on it, versus when I know I have competition, I might just go all out in my enrollment. Johanna, what are your thoughts that what you are seeing with your clients?
Well, actually, it's more common for PACE programs to have designated zip codes assigned than not. So I think, to me, it's interesting to hear Mindy's perspective on that, because that's something that is a reality for you. I know for PACE programs that have their own assigned zip codes, I don't know that they feel the pressure quite as much. So that's an interesting question that I've not really encountered or talked to a PACE program about.
I would add that in Michigan, there was a time a couple of years ago that there was a PACE program that was a for-profit program that wanted to come in and take over some of the zip codes or share zip codes with us. I will just say share. And we have a very dense population here in Southeast Michigan. It's very suburban, et cetera. But anyway, that we kind of went with the state, and they basically decided that if there's an unmet need happening, that there was this buzz language about unmet needs. And they basically looked at our enrollment very specifically based on feasibility studies with eligible people in the community in those specific zip codes. And it was showing that we were hitting this unmet need of a certain percentage of the eligibles being enrolled, that we were handling it okay. And it would just wash things over if it was like yours, Mindy. So it's interesting to hear that perspective, because how does a person decide, right? Like who they're going to enroll with or so forth. So it's interesting.
Yeah. Well, and one of the things too about Welbe, I mean, one of our key philosophies is that I don't want to take anybody from another PACE program, right? I want to get to the underserved. Sure. And so, the folks who don't have any type of care whatsoever. So that's the other, like, if you're, when people think about it being perhaps a competition of, is our growth in Fresno perhaps related to the fact that there is that competing PACE program 4 blocks away, and participants have just left them and come to us? Not necessarily. That's not been the case at all. I mean, they have their population that they serve, and a lot of it is around. A lot of it is around our Hmong population here in Fresno. They've catered to that population. So there's even been times when we have said, depending on what someone needs, that perhaps they would be better served at the other PACE organization versus our organization. When we have a huge Hispanic population, so I think the same is kind of happening from their side as well. We just have kind of found our niches and, embrace that. Obviously, we take anyone who meets criteria.
Sure.
But yeah. And I mean, people talk too. So some people might know, hey, I'm not getting what I need here. Or I have my friends, my Hmong friends, for example, who are going to the other PACE organization, and again, that's the beauty of PACE. We can make those different kinds of nuances to the program to be able to kind of give everyone what they need.
Yeah, I think that's very interesting. And I agree with you because the pie is so big when it comes to the eligible population. And I think our goal as a PACE organization is to serve more people so we can give better care to the participants who needs our support. But yeah, that is definitely very interesting. And Mindy, you did mention about a specific groups that you also target. And in California, it's more larger, even with Asian, the sub-Asian groups that are more targeted compared to, let's say, New Jersey, what we have. So do you have any plans currently with targeting certain ethnicity in your strategic growth?
I don't think there's necessarily, I wouldn't say that we're targeting it. I think we know when we go into a market or when we're in a market, kind of what to expect. We've done the research. We know who the eligibles are, what that diversity looks like. And certainly if I'm in a majority in a Spanish speaking population, I know that I need to hire Spanish speaking providers and nurses and outreach people and all those good things. So we don't necessarily target as much as we capitalize on what we know and go from there. Yeah. Okay.
Anything, Johanna, that you are seeing with like certain, in Chinese population or Korean population, the certain specific growth?
No, just to echo what Mindy is saying, I think that understanding your community, where your PACE program is located in, and making sure that you understand the cultural needs and create your program, structure your program to strengthen those or to lean towards those, that's important. So I know that there was a program that were trying to figure out how to deal with Somali immigrant population, very underserved, very challenged with language and adjustment in a new country. And PACE can really make an impact there, but it certainly have its challenges.
Of course, with speaking the language and where they feel comfortable with, I can totally see that. Amy, have you been seeing similar trends in Michigan?
Yeah, we have an area that is it's called Dearborn, Michigan, and it's the largest Arab American population in the country. And so at our Dearborn location, we have a prayer room and we provide halal food and some of the other things that are needed and required and to respect their community. And we offer that. So it's and staff speaking the language and so forth. So we do cater, as Mindy was talking about, knowing your audience and making sure you provide what's needed for them to be comfortable and come to the center and their families to feel good about them coming and it feeling good, like a great place to come. And that's the whole point here. So, and to help. So we just kind of do the same as what Mindy had said.
Yeah. And I think I always, and you definitely might not know, Amy, but I always say the best baklava outside Middle East is in Michigan.
It is.
I think they have the best baklavas there, but I can see because of the big Arab population there. And in general, I think, and this is to the audience as well, if you are thinking because PACE is growing, now moving, we are going to the years where more immigrants would be aging, like my father who came from India. And I think what's important to them is their culture, food, and language. Food is something, if you can provide they have a lot of specialist dietitian out there who caters a specific population, understanding the food, language, just to make them comfortable. And culture, I always say, it's not somebody needs to know exactly the Indian culture or Somalian culture. It's more to show them how we are embracing it and learning it.
Sure.
And I think those are the key factors that in the strategy could be used. Moving more forward, we talked about the ethnicity and that part, but there's also a huge rural population which is underserved. Seniors in that population. Any specific programs or target that you are thinking that what you do in a small town in California or a small town in Michigan, where they don't have access to healthcare as much as what we might have in a suburban or urban area?
We're pretty suburban in our area. If there's an area where there's not a ton, for example, so one of our sponsors is a large health system. And if there's not a lot of specialists in their area, we have to go find and contract with other qualified specialists in the area to allow these people access, again, to that type of care. But I think we all do that, even in a suburban population like us, to be able to offer that and have enough providers for specialists. I think that's pretty common.
I'm always curious of this one thing, right? Because in PACE, it's the hidden gem, and sometimes it feels like it's too good to be true. So when you go and talk to your participants about like, this is what we can offer, do they scratch their head and say like, what's the catch here? And how do you overcome those barriers?
Well, first of all, I think that there's people who you don't know about PACE until you need it, right? You don't know about PACE until your mama's living with you and you come home and she's tried to burn the house down or she's not here, and you're looking for her kind of thing. That's when you go and you start Googling about PACE. So I think there's a lot of people who don't know just what we can offer, the capabilities. And I think there are employees that don't know what we can offer. I think there are, contracted providers that we work with that don't know, what we can offer. So I think being able to kind of package all of that up and, just like we've learned, you have to tell people, I think before COVID, we used to say you had to tell people things 7 times to get them to remember it. One of my friends at work has said now because of COVID, it's more like 13 to 16 times that you have to tell people things so that they finally remember it. So, there's that opportunity to just every chance, every touch point you have with a participant or a potential participant to just reinforce, this is what we can do. This is what we can do. And it's not just about dental services, right? It's not just about dentures and glasses. It's so much more. And so being able to just kind of explain to them what a wraparound care program looks like, and coming into the center and taking you to your appointments and being the place where you can do your laundry, just things like that, I think are huge. And I think it's up to us as, PACE advocates, if you will, to continue to spread that word again, every chance that you get, just so people are aware. It's such an odd program. Again, 12, 13 years in it. I don't think, probably for the first 3 or 4 years, I had no clue of some of the things that we could do or, that especially like that we're doing now. So it takes a while. And I just think it's getting that word out there, getting people educated about it. And then things change too, right? Like we learned with COVID, things change too, what we can do.
And I think also simplifying the message as far as, the criteria for eligibility, the process of enrollment, how referrals work. Because I think sometimes once people grasp all that you could do, then they get intimidated by how complicated the process might be or might sound. So I think the challenge is streamlining those processes and the message and making sure that people feel comforted that you're going to guide them through it step by step.
So, Joanna, a certain thing in PACE, I always feel like I learned from experience that, what I should and should not do. But let's say a lot of your clients who are opening a new PACE organization and will have tons of questions and will be more like, Joanna, we need to grow by X amount of percent and all those great things. But then the participants will be like, well, I would love to join the program, but I don't want to leave my cardiologist or I don't want to leave my primary care doctor. So what do you advise at that time? Because it's a balanced act.
I think we would advise somebody to truly understand what's motivating that participant. What is their main concern? If they have a complicated medical condition, they might be concerned that their new provider understands their history, their treatment plan, that they don't have to start from scratch. So I think sometimes making sure that they get to meet the PACE PCP before they enroll, you can encourage them or explain to them that we would do a proper handover where they might still see their old physician once or twice as they transition to the PACE physician, that they will be talking to one another. You could share with them PACE outcomes. We have a lot of statistics about decreased institutional use, decreased hospitalization, good health outcome metrics that you could share with people. So those are some of the things that we would advise them to do, but it takes time and it takes relationship building sometimes to get that person to really trust that it's a good decision for them.
Yep. I would also add that we, one of the things that we do is, first of all, we have some videos and some tours that are virtual. Plus, we do offer for people to come in and sit and have a meal and experience the activities, because seeing is believing. And it is, the best kept secret, right? And we always do that. So, seeing is believing, and having them, the person and their potential families, it wins them over. I do want to say that we also, if somebody's really worried about giving up their physician, we will allow people to see their physician a couple times a year, contract with that physician as more of a social visit, though. We don't want the physician to order labs and all that kind of stuff. But just maintain that relationship. But I'm sure, as everyone else experiences, and this may or may not be the case, but once they start in PACE and they really start experiencing it, they don't go back to their previous primary care physician, because it's just an incredible family that they meet here. And so I think that's kind of also pretty common that we're experiencing all together. So I would just add that as well.
So let me ask you this, Amy, like the elephant in the room, right? As a previous medical director, you come in, growth is one of your job that you have to grow. And then I'm sitting with my team in an IDT meeting, and we know that friction happens about the pushback from the IDT that happens on certain patients or participants. How do you deal with those complex situations?
Yeah, when I first started, there was I felt like a little bit of a dartboard. Every time we'd talk about somebody coming in, it was like enrollment this, intake this, So anyway, we actually did something fairly creative here. I developed a position, and the manner in which we do enrollment. There's a position that we developed called a participant advocate, and they work in the enrollment and intake department, and there's one per center. And they introduce the participant kind of like if you were doing rounds at a hospital and you had to do a little review of the patient that you were seeing. And they really, really go into grand detail based on our assessment. And we provide an extreme amount of information pre-enrollment to the IDT that really helps them plan for the care. And it's the participant advocate helps with any tours. They onboard the participant by educating the team about them, introducing them to the team, and also onboarding them into the program for the first 3 months that they're in here. They call them prior to the weekend. Don't forget, if you don't feel well, call us. And so they're really helping the interdisciplinary team develop and manage that care right from the get-go and keeping in touch with the family. So it really helps relieve the team. So we're kind of helping as we're throwing, 50 enrollments at our teams a month, So
okay.
Yeah. So we thought that was the amount of medical information that we can provide, the more we can provide pre-enrollment, it really helps. And the team does an amazing job providing very, very detailed information. And we always say also, if you were a physician in a doctor's office and you had your own practice and you had a new patient, and the patient showed up for their annual physical exam, it's their very first appointment with you, they walk into the room and you know nothing about them. Nothing. So the amount of stuff that we provide to the interdisciplinary team pre-enrollment is incredible compared to that. So it helps, right?
Yeah. And that is music to my ears. So the secret for IDT, convincing IDT, is like more information is always good, and let us filter the information out that is not needed. So, Mindy, a lot of time, like I used to be like, oh my God, we have 10 new enrollments this month. Oh my God, how we will handle it. So 2019, 2023, at 2,200 participants, to my knowledge, that might be the fastest growing PACE organization in the country. How many you enrolled, and have you convinced your IDT members to be like, here you go, we are bringing 25 patients in this month?
That's a great question. And that is kind of what happened. And I've heard that actually the program in Fresno specifically is the fastest growing program in California, which probably equates to the country. We're bringing upwards at this point of 40 in a month. A couple things that we've done, I know, and coming from my previous PACE program, which again, kind of like you, Amy, was one of the first programs in the country, mom and pop, if you will, attached to a hospital. We would enroll 6 or 7 a month, and we were happy, happy as clams.
Yeah.
So yeah, coming here. And I'll also just start by saying the thing about WellBe is we never want to grow irresponsibly. We want it to be a very responsible growth. We want to make sure that we have things in place to grow, because at the end of the day, our compass is, providing excellent clinical care to our participants. And we all know that if you don't have the team in place, if you don't have the bodies in place to do that, you're not going to be able to do that, because like we've all said, PACE is really hard. It's something that we do that, it's not easy to take care of people at the level that we do it. So I think a big part of us, like especially in Fresno, just with enrolling as many as we have, is just really, I have previous PACE experience as a medical director. We understand the model. We understand what team members can do. We built a fellowship of trust where they were more than willing to, I shouldn't say more than willing. They occasionally had some pushback, like you said, Dr. Patel, with like, what are we doing? What are you, like, we can't do this. But I think as leaders, we changed that message. Like I knew I had this much of a team built. I knew what infrastructure we had built. And so just being that cheerleader, that's the biggest part, right? We've all been leaders for a while. If you come into an organization kind of like as an Eeyore, kind of like in the doldrums of like, oh God, y'all, I don't know if you're going to be able to do this, but we're going to try, right? It's not going to go well. They're going to be like, oh God, the leader doesn't think we can do it. What's going on? But if it's like, hey, listen, we've got this in place. We're taking care of that. We've added this team member in. Like you, Amy, we have a participant navigator. So that participant navigator is the liaison between the team, between the IDT and the participant. Our participants were saying, we're coming into this program and I've got 11 people calling me the first day of the month to schedule all these assessments. Like, leave me alone, right? And so we're like, okay, let's have one person call them, one person who can schedule all of those things. And then that one person is embedded with the interdisciplinary team, and she can go back and say, hey, Miss Jones is this, and that's what's happening. And, so that's worked out really well. I think that's been huge also, like you said, to kind of get buy-in from the interdisciplinary team. Plus, then they don't have to be following up on things like that. They don't have to be following up on why Miss Jones isn't coming in, or we know that that's what the participant navigator does. So that's been really good. But I'm telling you, a huge part of it has just been the continuous positive messaging of, we know you can do this.
Absolutely.
I know that you can do this. Yeah. And and it's always about like every time we enroll, every month, I always say like, these are 40 more people in Fresno County who are getting this amazing service from you all. That gives me goosebumps every time I say it, because I know the level of care that we can provide. I know, and sometimes that care is huge, right? It's all of this medical stuff, and it's all their medicines and their consults and all of these things. And sometimes it's just them getting out of the house and coming in the center and playing bingo. It's like the basic needs that we're meeting for our participants.
I would also say that one of the things we say, it sounds like our cultures are very similar at our organizations. Mm-hmm. And we definitely say to the IDT, if not us, who?
Yep. Yeah.
If not us, who?
If not us, who?
It really is impactful, because the people we have doing the care feel like you're right. It needs to be us, right? Because
Absolutely.
they're amazing. They're really here because they want to take care of people. And they
Yep.
really, really focus on the mission of PACE, keeping them at home. So I think that's a key thing also for the culture.
I'm definitely stealing that quote. If not us, who?
The thing that kind of struck me about this is that that's the challenge for newer PACE programs, right? Is they don't have the experience yet to fully understand just all that PACE can do and how innovative and how creative and out the box we can be. So they're kind of leading a little bit with fear still. So you need strong leadership that can help a team analyze what they're facing. What are the obstacles? Why are they obstacles? Let's throw some solutions on the table. Let's analytically work through which ones we can actually implement and kind of go at it analytically. But once you start gaining some experience of how to deal with these more complex people, that's what really fuels the fire. And you could be that champion and say, remember when we did this for Susie Q and how wonderful she looks now. That's when you really can get that momentum going.
I think that's where it is. I think sharing the success stories in PACE is like the next level thing. One of my favorite part always gives me goosebumps. So any of you have a success story that you love to share?
So we recently did the PACE Association of Michigan. We did a day at the Capitol, and all 14 programs bussed participants and staff to the Capitol to be in front of all the legislators and so forth, and senators and all that kind of stuff. And we had a tent outside, and we had lunch, and we invited them to have lunch with us and the participants. And there were people that attended this day at the Capitol for some advocacy work that are participants that literally could not walk when they came into the program, and they were out there dancing to the music and would share that with the senators and the politicians and so forth that came out. And they went to we sat strategically to where their districts were, so where the community that they were responsible for as elected officials. And they really, really were able to say, look at me now. I couldn't even walk, or I got a prosthetic leg and now I can stand. I mean, so they were able to share their own stories of what we did for them. And it was really, really incredible. So we have a lot of those. I mean, we've been around since 94. Part of our problem is our net enrollment because of how many older folks we have. I mean, obviously we all do 55 and older, but we lose quite a few people every month. But it's incredible what they saw and what we did. And that, I think, is one of the reasons that Michigan has grown so much in the PACE world. Because when I started 10 years ago, we were the only program. So to get 14 programs in 10 years is really amazing. And many of us have multiple centers. So it's not just 14 centers, it's 14 programs, and we have 8 centers alone with our program. So it's incredible.
That is such a wonderful story. I will actually encourage all the PACE program who can make this kind of a program happen, where you can take your participants to your state capital and meet your legislators and elected officials, and they see it. They hear story in real time. And I bet that will really give them the whole prospect of what we do in PACE. Mindy, do you have a success story to share before we kind of go on towards the end of our program?
Oh, yeah, absolutely. I can think of a couple, but one that I really, really love is actually one of our first month we enrolled 6 participants in October of 2020. And one of our participants was a husband-wife team. He was enrolling because she was in a facility, and and they'd been married for 58 years. They couldn't see each other, obviously, because of COVID. And so the team worked that first month to get her enrolled in October of 2020, get her and literally she came from the nursing home back home, did all of her enrollment assessments, all of that good stuff. And, the daughters and all of them said, for 18 months that we had given them their mom back because she was able to come home. Yeah, it was super, super sweet. He adored her. And she adored him as well. But just, you could tell when the team met them initially separately, he was very sad. He was depressed. He missed his wife. She had been in a facility again during COVID, and he hadn't been able to see her. So we have, that was one of the first stories that we did, for our WellbeNet, just to kind of share with everyone, because it was so, especially again, in the middle of COVID, it's just so touching to be able to do that. And that's exactly what we're here to do. We're to, bring people, keep them in the community, meet them where they're at, take care of what their needs, what they want, and do our best in doing that. So it was a great love story to be able to kind of reunite them. Yeah.
This is so beautiful.
We had a man and a woman meet at our PACE center, and they've since gotten married.
I love that.
We had the wedding at our center.
Of course, yes, love that.
Yeah,
isn't that?
You can look
so
on our website.
These are the things, right, that keeps us going. That every time we say PACE is difficult, a lot of time I'm like, why I'm doing this, But when I think about these kind of success story, that gets me back in that center Monday morning. And I'm like, let's do it another week, right? So, Johanna, before we go towards the end of the program, I'm very curious to see that what kind of trends, challenges, either success stories or any kind of barriers in strategic development that you see in new PACE organizations.
We kind of touched on them already to some degree. So, for example, making sure you get name recognition in the community where you're starting your PACE program, educating health organizations and patient populations onto what PACE is, and then also onboarding. Staffing, picking, onboarding, training your teams, making sure that your IDT is ready and poised to hit the ground running when people do come to the door. Those are some of the obstacles we see. And then some of the strategies, just leveraging PACE knowledge and PACE experience through PACE peers, your state and national PACE organization, PACE consultants, tech teams, wherever you can partner with people that have experience with PACE, as we were just talking about, the stories that really makes you understand what PACE does, and then focusing on team development and team support. Those are some key strategies to focus on for new programs.
Okay, before we go to the rapid fire question I usually do the rapid 5, but we have 3 panelists, so I'll do rapid 6. But before we go into that, for our audience, if they want to reach you for questions or anything, Amy, what's the best way they can reach out to you?
Sure. So my email is my first name, Amy, AMY, Katz, KATZ, at pacesemi.org. So that's PACE. S as in Sam, E, M as in Mary, I.org.
Okay. Mindy, how can our audience connect to you?
I'm on LinkedIn, so that's always an easy place to find us. And then also my email for WelbeHealth is Melinda, MELINDA, .wilds, WILDS, at WelbeHealth.com.
Okay. And Johanna?
Email is good for me too. So it's my first initial J, Dickman, at cpstn.com. And then I'm also on LinkedIn.
Same, LinkedIn and emails. Okay, let's go to our rapid 6 round for today. Mindy, this question is for you. What failing means to you?
Failing is where things happen. Failing is where you learn things. I think that, again, we didn't really touch on this a whole lot, but one of the things about PACE is we're at 100% at-risk program. And I think as PACE leaders, we've got to be comfortable with that. And being comfortable with being at risk means that you're going to fail. And that's okay, because that's where you learn, that's where you grow, that's where you take things on. If you don't fail, you're not doing everything that you could be doing.
Great.
Yeah.
Johanna, this is for you. Describe PACE in one sentence.
Oh, man. PACE is a real place where real team people gets to know you as a person, and they work with you to meet your needs and goals. And PACE is where you can age where you want and how you want.
Yes. Okay, Amy, if you had a magic wand, what is the one thing you would change about PACE?
It's really hard for me to do one thing. But
Okay. It's your magic wand, 2 things.
my magic. Oh, I get 2? Okay. Number 1 would be that it wasn't the best kept secret and everybody knew about it like they do most other community-based resources for the aging population. And my next would be that the eligibility would be a little bit more expansive so that more people who really need help but don't really meet that eligibility could enroll.
Yeah, I agree. Could not agree more. Mindy, who inspires you and why?
I think I get a lot of my inspiration actually from my participants. I think, again, I started out as a home care coordinator in PACE. So I've had an opportunity to, do home visits and meet people in a very informal setting and just getting their stories and hearing what they've been through and, how they didn't think that they would find something like us and they didn't know that they deserved something like us. I think that, I feel very honored to be able to take care of them in that way. So that's an inspiration daily. And then I would say also the teams that I lead. I love seeing that light bulb click on where it's like, oh, like you said, Johanna, we can do this? What do you mean we can do this? I think I love it when you see that aha moment happen. So I get very inspired by my teams as well.
Great answer. So Johanna, I have a special South Africa question for you because you are from South Africa and that is one of my favorite destinations that I have traveled. So wine tasting in Stellenbosch and Franschhoek, or you will prefer a morning safari tour at Kruger National Park?
100% a safari in the Kruger National Park, because I think much like PACE, seeing living creatures in the place that they're most at home is the greatest honor to me.
Wow.
So
that's awesome.
Yeah.
Awesome. Okay, Amy, one positive message for our listeners.
I would just kind of reiterate this whole conversation and how, if not us, whom, and what we do every single day really matters and changes the lives of those we serve. And just that we always have to kind of keep our chin up so that we can always provide the best for others.
Yeah.
Amazing answer. This was fun. Well, but we are at time, and thank you very much for joining me on this podcast. And it was a pleasure speaking with you.
Thank you for having me.
Thank you.
Prescription Health is brought to you by Tabula Rasa Healthcare, a leader in providing patient-specific, data-driven technology and solutions, with a mission to enable simplified and individualized care that improves the health of those served. For more information, please visit tabularasahealthcare.com.